So, hello everyone. It is with great honor that I would like to introduce our distinguished guest, Dr. Ramisa Fariha. A quick intro about her educational background is that she did her undergrad from Pennsylvania State University, Department of Biomedical Engineering, and she also worked with Dr. Jeff Morgan, an accomplished professor of medical science and graduate program, director for the biotechnology graduate program at Brown University, and she's a diehard fan of Dave Batista. I personally got to know that fact from the Business Standard report that was like published in 2020, and I really feel, it's one of the most important facts about her journey that actually inspired and also influenced her, that we're gonna see her as Dr. Ramisa Faria today. And it's an interesting story. I hope she'll share with us. And before starting the session, I'm gonna give a quick intro about Corbis. Corbis is a STEM-based research organization. So we provide our seminars, which is basically research based, and we also encourage Bangladeshi students, Bangladeshi youngs who are very much fascinated about this sector. It's basically all about the STEM, and there's also society and some other areas of knowledge. And alongside, we also provide seminars where there are some specific queries about US admission journeys and also admission journeys throughout the world. So this part of the seminar belongs to the Speaks Academia. So it's basically where we interviewed professors from all over, from Bangladesh, basically who are established in different part of the world and are pretty much accomplished in their different in their own respective sectors. So with that succession, today we have Dr. Ramisa Faria, and without any further ado, I'm gonna give my floor to my co-host, Ms. Afran Awarkan Obro. But before that, I forgot to give my introduction. I'm 𝐸𝐻𝑚 𝐸𝐻𝑚. I am handling the Director of Global Outreach Department at Corbis, and I'm a high school student residing in Austria, and hopefully will be graduate very soon. And of course, to be honest, I'm pretty much interested to this particular engineering sector. Of any kind of engineering fascinates me, but biomedical technology, that's a new thing. I really hope so you guys will enjoy. So I'm just gonna hand over the floor to Opal.
Thank you so much. Hello, Assalamu alaikum. Thank you, Tasik, for that excellent introduction. Hello, Dr. Ramisa. I'm Afra, the Director of Marketing and Communication at Corbis. Uh, I'm continually inspired as an admission candidate working with these geniuses. Corbis is a non-profit led by high school students, grade 9 to 12, dedicated to empowering the next generation through STEM, environmental sustainability, and social sciences. We bridge communities and inspire meaningful change through research workshops, online webinars, policy discussions, and hands-on projects. Today, we are excited to welcome our remarkable guest, which is Dr. Ramisa Fariha, and we have a few sessions upcoming. I would like to pass my floor to Tasin for the next academic session with Dr. Fariha. Please.
Yeah, well, before starting the session, I'm gonna provide a total timeline so that for our general audience, they don't feel that much of lost throughout the session. So first, we're gonna allocate some sort of time for her research life, and then we're gonna go through about her research activities in depth, hopefully. Then at the end, we have some general participant questionnaires where we already surveyed before, and some of the people who were interested in this particular field, they submitted their queries to us, and we selected randomly. And at the end, we're going to provide the flow to our general audience who really wants to ask some specific question to her. My request to you guys will be, please be concise and precise about her research. We are not a agency sort of organization. We we want you guys to have an overall idea, because research is something that I personally believe for our people in Bangladesh, it doesn't have that much of vast opportunity to gain knowledge. So Dr. Ramisa Fariha, she is the expert here, and she can guide us through her life and through her journey. And we are looking forward to it. And basically, to ask some questions, you guys have to raise hands in the chat box section, just like I'm doing it right now. So go to the React and just do the hands up or the clap, anything, any sign that, and then we are gonna select random people. So you guys have to be patient, of course, and I think so this whole session will last for about an hour. So I really expect your coordination and also some sort of, communications, and of course, patience is the most important thing. So I'll just start with the my questionnaires regarding her research life. So biomedical engineering, it is her subject, which is pretty much fascinating in my opinion. Bio include with medics, medical, and then engineering. So a lot of things going on, three things combined together. So my question to you, how you came up with that sort of area of knowledge that I have to pursue biomedical engineering. Although I know the gist of the story, but if you want to share to our general audience.
Yeah, absolutely. And thanks for the wonderful and warm welcome. Before I dive in, just a couple of things about me. I go by Dr. Fari with my students. I went to Penn State for my undergrad, and I worked at ACell Incorporated as a research and development intern. It's a big company that's now acquired by Integra Life Sciences. Then I came to Brown University to do my master's in biomedical engineering, which is when I worked with Dr. Jeff Morgan. And then I graduated in the middle of the pandemic. And then I started my PhD with Dr. Anubhav Tripathi. And I graduated last year with my PhD. And I started my postdoctoral work at the RNA Center at Brown. It's the world's first 𝐾RNA modification studying center, and I lead the mass spectrometry core there. Actually, I'm setting up the whole core. Plus, I also teach at Brown, so I teach the biomedical engineering senior capstone class, and I also teach biomaterials at Johnson & Wales. So I do a little bit of stuff. But anyhow, so how many of you actually know what biomedical engineering is? No? Yes.
Not exactly the entire perspective of it, but I do share a few views in the field of biology. I'm just an admission candidate. I just passed my ATC certificate exam, and comparing to my physics and maths marks, I got more in biology. So after that, I thought that maybe if I pursue my this interest in this field, then I would be able to further understand what biomedical, biochemical, and biomolecular, these sort of things um, further tells me about.
No, and absolutely. So biomedical engineering is a fairly new concept, even though it's been around for a while. But basically, the actual definition of biomedical engineering is when you have, so biomedical engineers or bioengineers are people who solve problems that directly impact the healthcare and global human health and policies, as well as discovery. So meaning, because there's that health component and the human component in it, biomedical engineers have to be some of the most ethical of all engineers that are out there. Okay. So basically, you're trying to solve problems. The way I explain it to people in Bangladesh is Manusha engineer. So it sounds really weird, but it's true, because anything I engineer, anything I deal with, it impacts human lives. So either পরোক্ষভাবে or প্রত্যক্ষভাবে, or experimentally, internally, externally, it somehow it always ends up impacting human beings. So that's why it's very important to be very ethical and to know exactly what you're doing. Now, going back to Tasin's question of how I started in biomedical engineering, actually, I realized I wanted to become a biomedical engineer when I was in seventh grade. So class 7, 9, going to Bangladesh, and imagine you're like, I'm going to become a biomedical engineer one day. So that was my whole story. The reason how it started was I grew up in a joint family, all brothers. I'm the only girl, the only girl and the baby in the family. And I grew up watching wrestling with my brothers. That said, I absolutely head over the heels fell in love with Dave Bautista. I was like wowed by this person. And he released his autobiography called Batista Unleashed when I was in seventh grade. And my uncle got that book for me. And I started reading about it, where he talked about his ex-wife, Miss Angie's battle with ovarian cancer. And for a second, I was like, wait, I don't know what this is. Back home, they don't really teach a lot about, like, they'll teach you biology, and human reproductive chapter is the one that they always gloss over, because you're like, okay, we are not going to teach about this. We're not going to address reproduction at all in school. So I was like, okay, let me start digging into it. And as I was reading more about ovarian cancer, I came across the work of Dr. Jeff Morgan. And Jeff at the time was trying to make at the time he was making an artificial ovary. He was trying to engineer one using mouse tissue. And I thought that was the coolest thing in the world. I was like, oh my gosh, this is so cool. Like, you could actually make an ovary. This is amazing. And I read his papers. I didn't understand a word of it. I swear to God. I was in seventh grade. Like, come on. I didn't understand a word of it, but I was like, okay, this is so cool. I'm going to grow up and work with him. And I told my parents, my dad's a lawyer and my mom's an art history professor. And they were like, okay, sure. I mean, we don't know what you're talking about, but okay. And so that's kind of how it started. And when I was a college sophomore, Jeff released his paper with the tissue engineered human artificial ovary. I was really like disheartened a little bit, but I was like, you know what? I'm still going to go work for him. Maybe there's a way, because the one he created, it's not implantable. So I was like, okay, I'm going to keep going at it. And so thankfully, for my master's, I had Jeff as my co-PI. And that's kind of like how I started. I got into biomedical engineering is I wanted to create the world's first implantable human artificial ovary.
Okay, so I mean, I know the story, and I'm also a big fan of Batista. Although I'm not, like, to be honest, I'm a Gen Z, so but still, my uncle used to watch the WWE, and he was so crazy about this kind of sorts. Also, I know it's pretty much artificial, but I really like him. And going to my second question, like, it's all about the existing opportunities in Bangladesh, basically in this particular field, biomedical engineering, where personally I really don't know, I really don't have any specific idea how many universities offer that particular subject. But although there must be some sort of subjects going on in Bangladesh, but how a person or a people or a young or a any genders who are really excited to study at that particular field, and they're going to pursue their career in biomedical engineering, what would be your advice in terms of utilization of existing opportunities offered by the university at that moment? So maybe, like,
Okay.
what are the tips and tricks that they must follow?
Yeah, absolutely. So that's a very good question. So the way I put it is the beauty of biomedical engineering in general, and let me just share a slide real quick because I already have this pulled up. Um, but oh, okay, here we go. But yeah, so can everybody see my slide?
Yep, we can see the slide.
All right. So basically, the beauty of like bioengineering and biomedical engineering is it is such an interdisciplinary subject. It sits in the middle of everything. So whether you like physics, chemistry, biology, math, computation, arts and crafts, you like generally like helping people. Um, it's all part of biomedical engineering, and it kind of like comes down to how you make the most of it. So what you're seeing here, like on the left side, this image kind of gives you a snippet on what bioengineering, biomedical engineering truly is. It's a combination of so many different things, right? And so even if you can be in electrical engineering and you can still leverage that opportunity to do biomedical research, you can be in physics and continue to work on biomedical projects. So to answer the first part of your question, I know I visited Bangladesh last in 2019, and that's when Dhaka University probably had their like first batch of biomedical engineering students studying. And so it's like relatively a newer concept. And now I know like at I know Shah Jalal University has a program, and then also Kuwait has, I think Kuwait and Kuwait, they both have programs. But basically, even if you're not officially in a biomedical engineering program, you can still leverage whatever type of engineering you're a part of to make biomedical innovations, right? It all comes down to applications, meaning um, the one thing that I always ask myself every time I'm trying to do something, and again, a quick disclaimer, I most recently got a patent, I have an American patent on one of the devices that I made. So Brown owns that. And so long story short, anytime I start creating something from scratch, my first question is, how is it going to help somebody? That's my first question, is how is it impacting? How is it making life better for somebody from a health perspective, right? And then I start almost like a process of reverse engineering, like, okay, I know this is the problem I want to solve. This is how I want to help people. So let me kind of backtrack and go back and start addressing the bottlenecks that are there. কি কি সমস্যা আছে, এই সমস্যাটা যদি আমি সমাধান করতে চাই, for me to get from point A to point B, what are the other obstacles I'm gonna create? I'm gonna have to solve. I have to overcome. And so দেখা যায় ওই procedure, because biomedical engineering is the reason why I love my field so much is এটা অনেক collaborate. Did somebody say something?
Yeah. Just sorry, no, sorry for the inconvenience. Maybe somebody just mistakenly unmute themselves. So it might be happen.
Okay.
So you just
Okay.
continue.
But no. But yeah. But the beauty is biomedical engineering is very collaborative. Eta probably, in my opinion, it's the most collaborative of all engineering fields, meaning to me, যে কারোর সাথে collaborate করতে পারো, you can come across, you can be in physics, find somebody at computation, and you can come up with something. I have a lot of collaborators. I did like 9 projects during my PhD, which is a lot. But I had collaborators in industry. I had collaborators in academia. I had public health collaborators. Those would give me samples for my clinical studies. So in terms of leveraging what you have, I think the important part is asking yourself what you want to solve, and then go from there. Does that make sense?
Yep, maybe it does, because for me, it's also a new course, to be honest, because I barely notice any courses named biomedical engineering, but got to know from a chat box that there is a department in BUET, so considering the biomedical engineering, but that's, I feel like, subjects like biology, lawyers, LLB, these are the things that are pretty much hard to replicate using AI. Although we should consider the artificial intelligence as one of our placing, but still there should be some limitations. But these are the field of area where there is at least some sort of certainty that now, okay, human brain are must needed at that case. So my question is related to that thing. So it's about the future prospects in this particular field. So how, and also we also got a question in the chat box. So what are the job prospects, and if anyone has a degree in biomedical engineering, how they can pursue their next careers apart from being a researcher? I know it's one of the occupations, but if anyone want to
Yeah.
be apart from researcher, so what should be the job prospect?
So just a couple of things. So let me put it this way. I don't know about other parts of the world. So in Europe, it might be different because last I checked, and this is when I was in talks with, I almost ended up in Europe, and here I am in the US. But they didn't have what's called the biomedical engineering program. They had the biomedical sciences program. So the big difference between EU and the US is they have more like a science approach to biomedical engineering. And in the US, you have a solid biomedical engineering and then you have a biotechnology program. The big difference is if you're in biomedical engineering, you need to have an engineering degree. There's no way you can switch over. But if you have an engineering degree and you want to go into biomedical sciences or biotechnology, you can. The big difference is at the end of it, all the engineers go through a similar type of training, meaning if you are in a biochemistry or molecular biology field, when you are a first or second year in college, you're going to do classes, say, where they teach you how to grow bacterial cells and how to isolate bacterial colonies and stuff like that, because it's part of your training. Meanwhile, for a biomedical engineer, which is the training that I went through when I was a first or second year, I had to learn how to balance forces on a bridge. Now, am I going to make a bridge? Never. Am I going to make a space shuttle? No. But it's part of my training. So for engineer, so this is one thing that I always tell people is I have 3 engineering degrees. I'm an engineer through and through, because engineering training is different than anything else. So if you are considering, say, your program or your institution doesn't have biomedical engineering right now, but you want to, say, pursue a master's or a PhD in biomedical engineering, my recommendation would be to stay in an engineering program, meaning you can do mechanical engineering, you can do electrical engineering, you can do computer engineering. So do any type of engineering and take additional biology and chemistry-based classes, because it's going to be very hard for you with a non-engineering background to get into BME. BME is biomedical engineering, so like to get into BME as opposed to switching out of BME to something else. Okay, so that is the first piece of the puzzle, is knowing that you need an engineering training. In terms of job prospects, now the job market in the US right now is awful. Let's be real, like there's been government cuts, fund cuts, and a lot of the scientists and engineers from the National Institute of Health got laid off, and the National Science Foundation. However, if you want to do, so the question that you have, Dasin, is what are the job prospects of BME in Bangladesh in general, right? So in general, BMEs, depending on your knowledge and your application skills, you can end up in big pharmaceuticals. So you can work for 𝐀𝐚𝐨𝐿, you can work for Square, you can work for like all of these big pharma guys, right? And then again, depending on your skill set, you can also work in a hospital setting. Now, I don't know how well versed Bangladesh is on this, but here in the US, if you have a biomedical degree, a lot of the time hospitals recruit you to especially be in spaces where they're doing robotic surgeries, where they have instrumentation, because they need you to keep the machines up and running. They need you to make sure they're calibrated. Half the time, the doctors don't know how to operate them. So they need a biomedical engineer in the room to operate all this heavy machinery, right? So there's that part. Then you have the computer aspects, right? So computation and bioinformatics, that is another field that's up and running. But basically, then if you're in Bangladesh, you would end up then working for the government, where you have the where you end up analyzing the bioinformatics data that the government collects from the healthcare population, right? So then your job is going to be working for the one Dr. 𝐀𝐻𝐿𝐲𝐻 is a part of the healthcare development, the CHDDRF, whatever the acronym for that is. So you have that part of things. Then you have the hardware side of things, right? Meaning there are now a lot of instrumentation, especially a lot of the base parts for certain instruments are made overseas, right? So depending on if you have, I don't know if Siemens Healthcare has a site in Bangladesh or not, but you can end up working for any of these big guys. You can work for GE, General Electronics, Philips, Siemens Healthcare, because then you do have that like mechanical side of yours and the electrical side of yours that comes in, right? And then of course there's always being a professor, like hello right here. You can always end up teaching the next generation of biomedical engineers, right? And another thing that doesn't get talked about a lot is the ethical side of things. So you can actually go into law after a biomedical engineering degree. So as a lawyer's daughter, I see all of these cases and I teach. I love bioethics and I love teaching that to my students, where you end up doing that side of things where you can do patent law, you can do bioethical law, and you can be a part of then the lawmaking panel in the country, and you can help them decide. So more like on a consulting role where you can help the country decide, oh, this is where we should let this investment company come in. So you can also have like that business and law side with a biomedical engineering degree. So that's kind of my an overall, I guess, perspective.
Yeah. Well, it just pretty much explained in a nutshell. But my last question to you, and I think it's one of the most important question. It's all about networking. So we all know that you have been working with Dr. Jeff Morgan at Brown University. So my question is that for our normal students who are really passionate about this sector and they want to do something with some renowned professors at abroad, how they can reach to them and what should they do in particular so that they have a possibility to, I know it's a different, I know the story, but still, but still, like if you want to say something about it.
Yeah, no, and honestly, I'll be very honest with you. I got extremely lucky. I'll be real. I got extremely lucky. It's not like, so I've been emailing Jeff since I was in seventh grade. I'm not gonna lie. But I didn't hear back from Jeff until one of his research professors took me and introduced me to him when I came to Brown. So for me to meet Jeff, I had to actually physically get my foot in through the doors of Brown as an accepted graduate student, then to be like, by the way, hello, I've done all of this. Go back, check your emails. And then also then what happened was, just like a little bit of background, is I got recruited by the 𝐀𝐻𝐿𝐲 Lee lab for biomedical optics. And I got recruited because nobody in the Lee lab knew how to do tissue engineering. And Lee wanted to establish a collaboration with Jeff. And Lee picked me because Lee knew I have the skill set that they would need for somebody to lead that project. So I ended up essentially being the bridge between Jeff's lab and 𝐀𝐻𝐿𝐲's lab, where I had to like firsthand do all the optical and so I was actually analyzing data on a supercomputer for 𝐀𝐻𝐿𝐲 Lee, but at the same time, I was also doing the hands-on wet lab stuff for Jeff. So it was more so I just happened to be competent enough in both areas that they picked me. So it wasn't even so much so like, oh, I got the networking. Now, the later part of my story where I got picked by Dr. Anubhav Tripathi, who he's also a renowned scientist. He has around a couple hundred patents, and he has over 500 publications. So that's my PhD mentor. And he has, for him alone, when I was a PhD student, I got a grant for $300,000 just for the research for him. So, it just, for the part of like how I met Dr. Tripathi is Tripathi and Jeff were very good friends. So when I was here, I graduated with my master's in the middle of the pandemic, and the whole world was shut down. There was literally, we were all stuck in our homes. That's when Dr. Tripathi, he had a COVID grant to develop diagnostics for COVID research. You know how we used to have this whole like nasal swab going up? And Dr. Tripathi was like, screw this, it's too painful, we'll switch to saliva. And he needed somebody to do that. And Jeff recommended me, Jeff, and there was another master's program director, Dr. Gray. They recommended me to Dr. Tripathi and said, hey, we have this student, she really wants, she's somebody special, you should definitely hire her. She's right now in Providence, International, do whatever. And when I was introduced to Dr. Tripathi, I said, hey, by the way, I don't do diagnostics at all. My specialty is cell and tissue engineering. And he's like, no, it's okay. Can you work? I was like, yes. Do you know how to hard work? Yes. Great, you're hired. And so then I kind of started, and I didn't have any training going into his lab, actually. I'm not a microfluidics person. I'm not a mass spec. I was not a mass spec person. I didn't know anything that was happening in his lab. All I knew was this man trusted me and gave me all these responsibilities to do things. And so I was kind of like thrown in with zero training because it's pandemic. There's nobody to train you on any of this. It's like you're learning on the go. So no one's going to like handhold you. So in terms of networking, yes, knowing Jeff helped me make that connection with Dr. Tripathi, and it just kind of like fell in places. But for me to get to meet Jeff, I just happened to be competent, and I was already an accepted student at Brown. So it wasn't a networking game, so to say. Does that make sense?
Okay. Yeah. So with that, I'm gonna end the questionnaire from my side. So Afra has some question regarding your research, and
yeah,
you can ask Afra.
Appu's answers are so self-explanatory and detailed that half of my questions are already answered. um, uh, Even after that, I'd like to ask you a few questions, which are some of which would be that your aspiration was to create the world's first implantable human artificial ovary, as you mentioned. So where did that come from? We already heard, but till that date to this day, are you able to achieve this aspiration?
So what's going on is, that's a good question, actually. I get asked that a lot. So the reason why I wanted to do the whole artificial ovary was the whole plan was, oh, guess what? People who have infertility problems, they can have a solution. People who have polycystic ovary syndrome, they can have a solution. But as you know, you start going more and more. I think two things that helped me shape my research narrative. One was when I was explaining, so when I worked with Jeff, I worked on breast cancer spheroids, okay? So basically making three-dimensional breast cancer tissues, imaging them, supercomputer, a lot of like futuristic stuff. And I know I was a second-year master student when my mom asked, my mom was like, I understand you're doing all of this cool thing, কিন্তু তোমার সায়েন্স তো বড় লোক মানুষ ইউজ করবে, মানে তুমি গরিব মানুষের জন্য কি করছো? And I was like, that is a very good question. Like, I never thought of that accessibility issue for a while. For me, up until that point, up until me working with Jeff, it was all about, I'm going to do the next big thing. I'm going to do the next big thing. So it was a lot of, I'm going to do all this novel applications and all this novel cool things, like cool science from straight out of sci-fi. But then that one question from my mom helped me then start reframing things. It's like, I'm not gonna, like, what am I really doing to make this accessible for people? And then when I started working with Dr. Tripathi, who specializes in microfluidics and diagnostics, he has one of the most well-funded labs at Brown. science is not cheap, and running a lab is not cheap. And this man, I have seen him, he has like money coming in and out. Like there was never a shortage of money in his lab. So for me, it was a big surprise versus like in Jeff's lab, it was like, oh shoot, I need to do what now? So academic labs are to chipku types, to kipta types. But Dr. Rivati, because he had industry funding, he spends lavishly. But then when I started working for him, I saw this man who has all of this money, he's trying to make things that are cheap, but they're still functional. They are mobile, they're portable, and they are easily available. Like they're much cheaper than what's available in the market. And so that altered everything for me. And then also the whole aspect of all the cool sci-fi research that you're doing, especially in terms of cancer and like oncological side, ওখানে হচ্ছে তোমার একটা ডিজিজ হয়েছে বা কেমনে হচ্ছে, ওইটা আদি পুরুষ এই এনজাইমের জন্য হচ্ছে, এই গেট খুলতেছে, you end up going into the nitty-gritties of it. And what Dr. Tripathi was doing was, you know what, I understand এখন এই ডিজিজের কোনো solution নাই, but how can we have all these diagnostic procedures done ahead of time যাতে মানুষকে আমরা either we can give them a prolonged life or they're diagnosed early enough that they can be addressed. And I thought that was super cool. So then that shifted my entire research narrative from like, oh, I'm going to do this like sci-fi expensive science to guess what? I'm going to start making diagnostics that make disease detection and disease screening faster, cheaper, easier, and global. So that's how my entire narrative shifted. So right now what I'm doing is, instead of making the artificial ovary, which would address if someone gets an ovarian cancer, goes for an implant, blah, 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 which is like, it's going to take 50 years. What I'm currently doing is I'm trying to come up, so I have like a couple of layers of my project. One is I'm making a biobank or a database, what you would call, যেখানে ovarian cancer biomarker তুমি collect করবে, but not from a single population, right? কারণ বাংলাদেশিদের health and Americanদের health, it's not the same
Not
thing,
the same.
right? African health and European health, it's not the same thing.
Not the same
So you
thing.
need to get information from the whole world.
Yes.
So what I specialize in, it's called a microsample,
Okay.
meaning খুব অল্প, মানে ক্ষুদ্র specimen যেটা বলে আর
Yes,
কি, মানে
yes.
ক্ষুদ্র নমুনা, that's the correct Bengali word.
Yeah.
So ক্ষুদ্র নমুনা, that's what I specialize in. And the whole concept is you can have, and they're collected in what's called a dried blood spot, meaning
Yes.
একটা কাগজের মধ্যে তুমি আঙ্গুল ফুটা করে রক্ত দিবা, and that কাগজ gets shipped to me, okay?
All right.
And the whole concept of that is you can get samples from anywhere in the world. তোমার ফ্রিজিং এর চিন্তা নাই, তোমার শিপিং এন্ড হ্যান্ডলিং চার্জ নাই, কিচ্ছু নাই। তুমি কাগজের মধ্যে এরকম স্পট দিয়ে আমাকে ওই কাগজটা চিঠির মধ্যে পোস্টকার্ড, আপু তোমার জন্য ব্লাড, পোস্টকার্ডের মতো পাঠিয়ে দিবে, and then I end up working on it, right?
Yes.
And the information I get out of it goes in that database. Now, couple of challenges for me to like get that blood from you and making
Yes.
it into a database is technology নাই। তুমি একটা কাগজ থেকে, কাগজে একটা ছোট্ট এরকম একটা এক ড্রপ ব্লাড থেকে তুমি এত বড় একটা বায়ো ব্যাংক বানাবা, যেখানে তোমার মেটাবোলাইট ইনফরমেশন থাকবে, তোমার জিনোমিক ইনফরমেশন, এপিট্রান্সক্রিপ্টোমিক ইনফরমেশন, proteomics information. It's a lot, right? And so where I came in is, not only do you need technology to get all those information out, but also you need to make sure it's so robust. কারণ এখন হচ্ছে, robotics is the new thing. So everyone wants everything automated. So then I created the device যেখানে তুমি, and usually তুমি যদি traditional chemistry workflow use করো to get all this information out of blood spots, it takes you about 2 days. ওইটাকে I ended up making a device that cuts it down to 180 seconds, and it's robot friendly. So you can use a robot to do all this extraction.
Yes.
So then right now I work on a few things where I have this like kudro nomuna going in and collecting all this information, but at the same time, I have like this $2 million instrument that I use to do all the analysis. But that's the beauty though, because আমি তো
Yes.
এই $2 million instrument বাংলাদেশে নিতে পারছি না, but
No,
I
no.
can bring the Bangladeshi samples here, and I'm also
Make
addressing
something
the
useful out
front
of it.
end. Yeah.
Yes, yes.
So that's kind of like where I am. So instead of, let's say, making the ovary, it's more so because it all started with ovarian cancer, right? Right now, the goal is how early can we detect ovarian cancer? যাতে করে, it's early enough that you can start treating them. So instead of like, yeah, so it's more like এখন applicable কি আমি 50 বছর পরে নাইলে I'll do all the cool stuff, but what
Yeah.
can I do to make people's life better this very second?
So you're already halfway into your goal.
It's a long way. It's a long way.
The process is going on. So your answer also answered my next question, that was how did you the transition from focusing on your studies to applicable studies. Well, moving on to the next question, which is that with the availability of less facilities available in Bangladesh, what tools do you recommend to leverage this biomed program? Say, for example, us aspiring students, we just want to help you with collecting the blood samples from all over the world. So what are the suggestions that you would give to such biomed aspirants in this line with the less availability of facilities in Bangladesh?
No, absolutely. So that's a very good question. So the thing is, I come from a land of like very collaborative environment. And Dr. Tripathi was the kind of person who'd like let me do whatever I want. Now, my postdoc PA is not like that. But that said, he's more like the traditional academic route. Kind of, if you're trying to build a collaboration, you have to do all this paperwork. You have to like have the PIN, you have to do the other PIN. And I'm guessing Bangladesh is the same way, where you cannot do all this stuff. You need to get your PI involved if you want to do all this like sample collection stuff for somebody, right? So then the strategies, there are a couple of layers to it. After you go talk to your research advisor, right? Hey, by the way, this is something, here's a paper, I want to do this. Do you think we can reach out to like other people outside? Now, that said, Bangladeshi researchers who are out, at least the ones I know in the US, we are very open to helping those from Bangladesh. মানে আমাদেরকে বলতে দেরি নাই, and we're like, here, I'll do everything I can to help you guys out. And so that helps a lot. And not just in the US, I think a lot of people don't know this, but the 𝐀𝐚𝐿 Institute so KAUST, it's called, King Abdullah University of something and technology in Saudi Arabia, KAUST. They have a very advanced biomedical engineering program. And I know this because one of my first undergrads at Brown, 𝐀𝐻𝐿𝐸𝐻𝐚 আমার সাথে research করেছে since he was a freshman. He graduated from Brown University in biomedical engineering, and then he went to KAUST to get his master's in biomedical engineering. And KAUST, we also have a very renowned Bangladeshi professor there, 𝐒𝐻𝐻𝐿𝐸𝐻𝐚. And I know him because he graduated from Penn State too. But long story short, there are Bangladeshi researchers everywhere. So if you're like, hey, I actually don't know where to even start, you can always reach out. And these are all like public information. If somebody is a researcher or a professor, it's very easy for you to go get their like institutional email. And you can always email them and say, hey, can I get an informational interview? So informational interview is not you begging them for a job. An informational interview is when you just talk to them. You want to hear about their work. You want to hear how they got to where they are, and what steps you can take. You can ask like directly for advice, like, hey, this is what I'm doing. I don't know how to talk to my advisor. And they're some of the best people to give you information. And let me tell you this, I have a whole ass doctorate, and I still reach out to people for informational interviews all the time. I'm like, I don't know what to do. Because it is okay. It doesn't, like, just because you have a PhD doesn't mean you know everything. Even I'll say this to my students, like, I actually don't know what that even means. So it's completely okay to not know things. So reaching out to Bangladeshi researchers for informational interviews, great. And also, I know Bangladesh is trying to do a lot on a research front. It's just we don't have an institutionalized or a centralized approach. And that is something I know there's a group of us in the US, we're trying to do this. We're like Bangladeshi alumni who are in the US. We're kind of trying to make this happen. It's going to take a while though. But yeah, definitely reach out to researchers who are Bangladeshi all over the world. Request for an informational interview. And if they say, hey, I want to meet you at like Bangladesh time, 3 a.m, 2 months from now, take it. Get it on their calendar because it's our calendars get booked up so quickly. Like Bushra would know. I was like, bro, send me a calendar invite for this Saturday, or else it's never going to happen. Like you won't get me available until for like next couple of months because the way that's just the nature of how busy we get. So if someone is saying, oh, I can meet you after 3 months, take that. That's probably the earliest they have opening.
Right.
Make sense?
Yes. All right. So thank you so much for answering this question. And moving on, I have just two questions left for you, which is that I would like a very short answer for this one. That is that how has the BMI research culture evolved over the years, especially in promoting diversity and inclusion? What would you say in this perspective?
Good question. So basically, DEI in research has always been a problem. Now, though, with this new generation of engineers, which is like our generation, we are more cognizant that the pool of information needs to be very diverse. And that's why, technologies like mine are getting traction because it talks about democratizing research, meaning you have information from all over the world. And now I know Stanford and Harvard and Yale, they're going out of their way to recruit South Asian participants for some of their research studies. So it's becoming a thing. Right now, funding is tight, so it's probably going to get a pushback. But it's people are aware that it's not a one-size-fits-all solution.
All right. And my last question would be that your work has advanced sample preparation and extraction, LC and liquid chromatography, MS and MS, HPLC, quantification, computational modeling, etc. So I went through some of your works and all of these bringing versatility in becoming a biomed engineer. Could you share one or two more key projects or breakthroughs that best represent your contribution?
Good thing. That's a very good question. I was working on an application yesterday and I was like, shoot, I have done all of this. There are a couple of things. So definitely
there's
the
so
world
much
of
more I've listed. I could go on and on about this.
It's true. I mean, it's not. Let me put it this way. I finished my PhD in 3.5 years with 9 projects and $300,000 in funding. It's not normal. That is an abnormal case scenario. I used to live in my office. So, don't live your life like I did. But that said, couple of things. So one is, of course, like you've said, the whole point of like dried blood spot extraction. So I think my patent is one of my like key career highlights where not only Brown patented the device itself, but they patented the entire physics behind it. So the whole physics is I demonstrated the use of world's first hollow cylindrical electrode. And people are like, wait, what? And I'm like, actually, yeah, you can use it. You can do this. And I did that whole thing. So that was something that I really am proud of because people couldn't put the two together. And I was like, here, let me show you how it's done. And so that is something I'm extremely proud of. Another work that got a lot of like media traction was my work with antidepressants. So it was the first complete automatable assay for liquid chromatography tandem mass spectrometry, which is the technology I specialize in, where you need only 20 microliters of serum, which is very small in the grand scale of things. Like, it's close to nothing. And so we did that. And the whole concept was you can do at-home sample collection, and you only need that 20 microliter serum, and especially for postpartum depression monitoring. So that was something that I really enjoyed. That was like one that got like everyone and their mothers talking. Like, we had people from like AAAS and science and G2 intelligence coming in the lab and taking our pictures, and we were like, whoa. And they're like, well, can you guys wear your lab coats? And we're like, we don't even have lab coats. So I had to go borrow lab coats from the next lab.
A
But
breakthrough in research.
I know. And it was funny, like, none of us wore lab coats. And we're like, shit, my undergrads are like, Ramisa, we don't have lab coats. I was like, yeah, go borrow from some from Vikasa's lab. So that was a fun one. Another one, and this is like a project, like this is a paper kind of, we presented the poster, but the paper is still under work, is I designed and developed a 3D printed organoid on a chip platform. And we used a PARP inhibitor treatment for ovarian cancer spheroids that we grew in that organ on a chip. And then we used mass spec to do the drug concentration measurement on the chip to see how effective this like 3D systems are to replace animal testing. So, 3D testings are like becoming the next thing to replace animal testing, but they're very expensive. So then we had like a whole like this tiny of a chip that was 3D printed entirely and did this whole thing. So
that's a significant part in right now, because we don't want animal testing anymore.
Yeah, so that's something that we did. And there was another fun project that we did. Well, I actually did two more fun stuff. One is I showed the use of artificial saliva. And I used that. So it was like the first use of artificial saliva on for any diagnostic purposes. But then the whole point was you can start using saliva for cortisone measurement. And then another one was the use of earwax. One of my undergrads, he wanted to study earwax, and I was like, great, we'll do this. And so we ended up studying earwax for diagnostics as well. So kind of done some fun stuff.
So cool. I cannot wrap my head around all these facts that naturally it someday comes to you that, okay, let's do this on a random day after so much study. So from my part, my question is over, and I'm so glad to have you. And I'm passing my floor to Tasin once again so that he can take the questions from our participants and ask you from those parts. And thank you so much once again. Tasin.
Thanks, Afra.
Well, perfect. So we're coming to the last session, last way of conducting the session. So we're gonna take some participants' question. But before that, there is a most important question from Faiza Hawk. Thanks for your patience, to be honest. She asked, is it possible to enter the biomedical engineering field with a biochemistry degree?
So that's what I said. It's easier if you have an engineering background to enter biomedical engineering as opposed to not having an engineering degree. So I would rather recommend that you have a degree. If your institution doesn't offer BME, I would say get like an engineering, mechanical engineering or electrical engineering or whatever you have available, because engineering থেকে তুমি অন্য কিছুতে switch করতে পারবা. But then if you don't have that engineering base, it's going to be hard for you to get into biomedical engineering. Maybe you can do biotechnology or biomedical sciences, but not biomedical engineering. At least that's in the US.
Okay. So Additionally, she also asks that between biotechnology, pharmacy, and engineering, which major would be the better for medical research?
Um, it depends on your end goal, honestly, ফাইজা। কারণ তুমি কি প্রবলেম সলভ করতে চাও সেটা তুমি জানো। So a lot of the time when we started out, we wanted to learn everything about everything, which is a
Yeah,
weird
Assalamualaikum
problem.
Apu. May I talk?
Also,
Yeah,
yep,
Yeah,
go
please,
ahead.
you can carry on.
I'm facing the same. Thank you for your presentation. For first of all, like I've learned
Yep.
so much from your talk, and it was a joy
Yep.
to attend this meeting. So basically, I'm facing the same problem as you. I want to learn everything about everything, and I want to choose a very interdisciplinary subject. So I want to get into medical research, not specifically engineering.
Okay. So is your plan to like stay in Bangladesh or move overseas?
I want to study overseas, but like I don't want to settle abroad.
Okay. So then the question becomes, if you are just planning on doing medical research, then you
Yes.
can do something like pharmaceutics, biochemistry, and of that sort. But again, the whole drawback of doing like hardcore science, which is like chemistry, biology, biochemistry, all of that, is they make you answer fundamental questions. They're not going to show you the application side of things, which is what biomedical engineers do. But then for being a biomedical engineer, almost all programs require you to have an engineering degree. Does that make sense?
Yes, I got it. But if I choose biotechnology instead of engineering, would that help?
Biotechnology is fine. That is also cool. You can do that. In a lot of schools, it depends on how the school defines it. A lot of the schools limit biotechnology for more agricultural research. So like bacterial work, they'll do plasmid research, they'll do yeast stuff, so they don't really do a lot on like the human health front. But that varies from like program to program, school to school. So ওই case you have to understand তুমি কোথায় অ্যাপ্লাই করছো, ওই স্কুলের কি স্টেট অফ দ্য প্রোগ্রাম।
Okay, thank you.
Make sense?
Yes.
Hello, I have a few questions, if you don't mind. Can I ask my questions?
Yeah, you can ask your question, but from the next on, I'm gonna request those who are raising the hands, we, the host, will call the participants. So it's better if you guys have some patience in this regard. So Hadin Islam Khan, you can carry on, and I hope your question must be concise and precise about her research life instead of visa thingy.
Yes, of course.
Yeah,
Okay.
perfect.
So my question is, I have an application for, I've been admitted to the University of Texas at Dallas for BME undergraduate degree. So I just want to know what projects or what research or skills should we develop in our undergrad to land internships, which would basically help me get into like Ivy League for my master's or get into research basically.
Oh, that's a good question. So I think if you're congratulations on you to Dallas, that's a good school. Once you go in, my recommendation to all the students is, if you want to go to graduate school, start research early. So start reaching out to professors even in your first year and say, hey, I want to pursue a graduate degree, therefore I am very interested in joining a research lab. And you have to be very patient. Research is not easy. It's very slow. It moves. It's very different. So you just have to enter a lab that, one, the lab should be interested in taking you. And two, when you go in the lab, make sure you work hard. Okay. So make sure you get involved in research as early as possible. And then at UT Dallas, they should have a career advising center, and they can help you land co-ops and internships.
Right, thank you so much. And I just have one more question. That's, should we go for a BME degree in undergrad or something else like electrical engineering or chemical engineering, because those are more broader?
If you want to end up in BME and if your institution offers BME, go for BME.
Thank you so much.
Yep.
Okay, so we got other participants. Ariba, you can unmute yourself and ask your question.
Hi, Abu. So I heard all your discussion sessions, so it was really helpful for me and it was also very insightful. So I just wanted to ask that I'm currently pursuing my undergrad degree in biotechnology, and I wanted to know that if I wanted to do like further, I actually don't know which sector I'm going to pursue for my masters. But if I want to
Okay.
land a good, if I want to go into a good university in the US, or if I want to land a good internship, what type of things should I start doing from now from my field? I'm kind of clueless.
Okay, so good question. So if your institution has research opportunities, which I'm pretty sure all institutions do. I see somebody from Kuwait and I know Kuwait has research opportunities for
Brack
undergrads.
University.
Okay, in BRAC. You should definitely have research opportunities at BRAC. So reach out to professors, যাদের research lab আছে, and ওনাদেরকে বলো যে তুমি ওনাদের ল্যাবে research student হিসেবে join করতে চাও, because even a little bit of research experience helps you get into graduate. So that's the first thing. Second thing, তুমি যখন apply করবে for your so grades definitely matter, but for graduate degree, your passion for the research and your story matters. যে তুমি কেন ওই specific institution যেতে চাও, তুমি কেন ওই specific field যেতে চাও, all of that jazz, right? So as a result, তোমার কাছে যখনই research opportunities আসবে, and যদি institutionের ভিতরে না পাও, look elsewhere. I know that there are spaces in Bangladesh that invite undergrad researchers. I know like this girl, Nazifa, ও এখন Penn State আসছে, ও বাংলাদেশে research করতো, and I love that girl. And her research wasn't even like hands-on research. She was in science communication, but even that little bit of thing leveraged her graduate school application. So
So
yeah.
basically, Apu, you're saying that I should reach out to my professors in my university and express to them that I do want to participate in research, but I'm clueless and I do not know which sector.
So don't say I'm clueless. Be a little strategic about it, but more so tell them that you're interested, you want to learn more about their work, and you are not entirely committed to a field. So তুমি এখনো committed না তুমি কোন type of research করতে চাও, and then kind of go from there. And লাগলে এক ল্যাবে এক semester করো, এক ল্যাবে এক semester, এক ল্যাবে এক semester, and then see what you like best.
Yeah, okay. So I should just start by saying that I do want to learn. So I'm not really committed to this particular field, but I want to learn. So I should go for it.
হ্যাঁ, মানে একটু strategic হও, মানে don't tell the professor যে আমি জানি না আমি কি করবো. Just say that, oh, I'm interested in your work and I want an opportunity to learn. বলে তুমি you start working with them, ভালো না লাগলে then you say, oh, স্যার আমার ভালো লাগছে না, I'm gonna go to a different lab. So you gotta be a little strategic.
Okay, got it.
Okay, I would like to add one thing beside Apu. So it's basically the most important thing that our professor actually wants from a student. It's the attitude, how eager you are to learn something. So in that case, if you really show your attitude towards the learning, towards the outcome that you're gonna get from him or her, that's gonna impress the person afterwards. So the more you can show your capability to that person, the more chances you got to collaborate with that person and also to work. So it's all about your communication skill, your attitude, and your focus strength. So it's not and what you say, it's strategic. So if you really show your weakness before digging into the work, so no one will gonna be there. Oh, okay, uh, they will think that okay, that person already just gave up. So that shouldn't be done, right? So that's what we should be careful in that regard. So I'm gonna take the last two questions because we're exceeding the time. It's already over 1 hour, so we shouldn't like we're all, and of course we know like Apu is so much busy, so we shouldn't take a lot of our time. So my last question, Muin Wali Mahir, can you please unmute yourself and ask the question?
Uh, Hello, Apu. Assalamu alaikum. Actually, you are studying in my dream university. So, like, I was very excited to learn that there is Bangladeshis there. Now, my question is actually, what type of specific extracurricular activities would you recommend to join Brown University that would actually enrich my activities, enrich my opportunities to join for fields like psychology or biomedical engineering? What type of PCA would you recommend doing?
Okay, good question. So I did, just so you know, I did my graduate studies at Brown, but we have a lot of Bangladeshis doing undergrads at Brown. Actually, ওরা আমার বাসায় আজকে রাত্রিবেলা আসবে, if that makes sense. So a lot of them, অনেকেই ঢাকার actually, and I truly don't know what all they had, but I definitely know to get into any of these Ivies, whether or like Ivy plus, should I say, the Ivy school plus like MIT, Stanford, and the whole collation, is ওরা না তোমাদের more, even more so than the extracurricular activities, they want to know who you are, and তোমাদের ওই যে research essayটা থাকে, the application essay, that's where they put a lot of, they want to know, they want to read your story. So try to have a more compelling story. তুমি এক্সট্রা কারিকুলার করো, ঠিক আছে, তুমি 10টা এক্সট্রা কারিকুলার করো, বাট যদি তুমি 10টা কেন করেছো ওইটা যদি তুমি সুন্দরভাবে আর্টিকুলেট করতে না পারো, it's kind of useless. Does that make sense?
Yes, Apu, thank you.
Yep. And also I'm gonna ask Corvus to like try to get one of these guys, or even like do a panel of all the Bangladeshi undergrads at Brown.
Yeah, of course, we'll try to reach them. But the main problem is that the time schedule right now, we're mostly high school students, so most of them we have like HSC exam. So hopefully we're gonna allocate some time, and also we're gonna reach them towards the end of the exam. But basically we're looking forward to it, and we'll try our best. And I think so with that, let me check for last time. Yeah, well, there is a person who asked, that's the last question. Extremely sorry.
No, you're fine.
It's basically I want to be an oncologist and cancer related scientist in the US. Which should be the best pre-med program in the US for my future dream?
Oh, pre-med is a tricky one. So I have students who do biology and pre-med, who do biochemistry pre-med, and then they do biomedical engineering pre-med. Getting into medical school is a whole beast in general. I have students who are now preparing for medical school. I have one of my undergrads who's currently doing an MD PhD at Yale. And then I have an undergrad who's doing who was my undergrad, now doing his medical school at Harvard Medical. It ends up boiling down to one, of course, your MCAT scores. MCAT score অনেক important, but also your overall worthiness of the application. So আমার যে স্টুডেন্টরা, আমার একজন স্টুডেন্ট আছে, ওর আমার সাথে 2টা না 3টা পাবলিকেশন আছে, and ও আবার স্ট্রাইকার যে কোম্পানি ওখানে ইঞ্জিনিয়ার, but still, he's struggling to get in to med school. So med school and pre-med is a rough one. I would recommend choose a program that's competitive and make your application as competitive and stand out as you can.
Yeah, okay. So there's a guy, Mushfiqur Hassan Siam, and he's I think the most junior participants in in our today's session. So he got a good question. He is pretty much passionate about going to MIT, and he wanted to know what achievements and activities, less extracurricular activities, he must possess so that he have a strong chance to get there. And he also wants to pursue the biomedical eng. So any tips or tricks?
Okay. Oh, that's a rough one. I mean, everybody wants to get into MIT. I mean, it's a cool school, not gonna lie. Again, I'll be very honest with all of you. It all boils down to, I personally think it all boils down to luck, because when I review so many candidates and so many students, sometimes I'm like, wait, তোমার মনে হয় একটা গর্দভি কেন আছে? And then you'll see like, wait, you're this brilliant guy and you couldn't get in at Brown? Like, what's wrong with Brown? So it ends up boiling down to a lot of things. But like I keep saying is, তোমাদের extracurricular activity is important, try to show that you're inclined in research and you have a holistic profile, but also make your story speak. মানে তুমি আন্দাগুন্দার মতন এরকম 10-20টা এক্সট্রা কারিকুলার করলা, but it's not a cohesive story building. It's not going to get you anywhere. Okay. And if anything, try to reach out to like existing MIT graduate students. প্রফেসর না, যারা এখন পিএইচডি করতেছে এমআইটিতে, অনেক বাঙালি আছে, ইভেন এমআইটিতে অনেক আন্ডারগ্রেডও আছে যারা বাঙালি। রিচ আউট টু দেম and start building that network, because a lot of the time some of their recommendations can land you in places. So make sure you are networking. Like that aspect of networking, going back to Tasin's question, is sometimes it helps a lot. So at least make that proactive initiation. আমি এখন থেকেই কয়েকজনকে ইমেল করলাম, and just reach out to, there are a lot of Bangladeshis in the New England area. There's me, there's like, we have a shit ton at MIT. So just start reaching out.
I think so. It answers your question. So with that, we're gonna end the today's session. Last of all, on behalf of Corvus, I convey my heartfelt gratitude that you showed up today, and you also gave us a lot of time, 1 hour. That's not like, I know how hard these days are being. So it's still, on behalf of Corvus, on behalf of our family, I really wish you the best. And of course, if in future times you're gonna see us, and maybe some of the participants who are there into this session, maybe one of your undergrad students might be, civils are high. And
Yeah. Oh, that would be cool.
yeah, we'll
But
try
yeah,
our best to get connected. Yeah. Last words from your
yeah,
side.
and I get a lot of requests on social media and stuff, and it gets overwhelming to answer everything. So if you all want to do like a streamlined question set over to Corvus, and they want to do like another Q&A session, happy to do that. It's much easier for me to have all of you in one space and answer everything once, instead of like responding to 200 emails. So, if you have questions, I would just say like email these guys and they can always reach out to me, and I'm happy to do another Q&A session.
Yeah, we'll be so much happy to have you again in another session. So with that succession, I'm gonna request everyone to leave the session, and thank you so much for joining, and thanks for your patience, and I wish you the best for your future endeavors. You guys can leave.
Good luck,